He's president of the superintendent.
And then a week. They have to tire out. The kids are going to
Thank you all for coming back for the second part of Public Square, and we're joined by a few more people in our leadership panel where we talk about solutions and other outcomes. I want to start with you, Charles. The Legislative Finance Committee did an exhaustive report recently about teen pregnancy in the state, and it touched on sex education as well. Can you just talk a little bit about what you found?
The state needs a better plan for how to address teen pregnancy. Sex education and health education obviously has to be part of that. It has to be coordinated across the health department and the public education department at the state level, working with communities to implement programs that work. And we think also targeting geographic areas of the state that have a high risk and have high numbers is really needed to continue to reduce those rates.
So the LFC has put out this report, and you have specifically said the DOH, PED, HSD, other departments need to coordinate better. What happens from that?
We suggested that the legislature pass legislation being more directive to the health department to take the lead. Likely that won't happen going into a short session unless the administration gives that idea a legislative message. So in the meantime, the health department can take action on its own to start doing these things. You
also found that half the schools surveyed were not fully implementing the standards that are on the books with PED. Do you have any insight why?
There's currently a process that requires school districts to essentially certify that they're implementing the standards, but there's not necessarily the oversight capacity for the department to go out and enforce compliance. I think in a coordinated strategy, the health department and public ed department could likely identify communities where we're seeing persistently high teen pregnancy, and then start reaching out to those particular school districts to make sure that they're integrating their part of health education into the overall strategy to reduce teen pregnancy. And if they're not, then help them to do that in a way that gets local community buy-in and family support.
And I will say we asked the Department of Health and the Public Education Department to join us. They declined to send anyone. Department of Health declined. Public Education Department said they didn't have anyone available, and they felt that these were local decisions made in school districts. Do your reports tend to sit on the shelf, or do people listen to them? Do people take action on them?
We like to think that they take action on them, and we do follow up and report back to our committee on the progress that agencies have made and have found pretty good responses from agencies. There's going to be some recommendations that at the end of the day we agree to disagree, but if you see the response of the health departments in our report, it was positive. They think that this is a winnable challenge for the state of New Mexico and have a lot of ideas, and I'm assuming have already starting to embark in implementing those.
Megan, can I I just want to go back to where PED said they felt like that it was a local decision. I think when we really put reproductive health education aside, like, well, it's sensitive and we'll let different school districts decide on what and how they want to teach it, I think we're doing a disservice. We would not allow that with English or math, I don't believe.
Right. I think it's hard as well, and because as a charter school, our teachers going out on a limb, it can be dangerous. So it would be nice to have leadership in that area.
Chris, what do you think? You are a veteran. You helped push for these state standards for years. I mean, now you're with APS.
I'm with APS now for last
I'm just curious
years.
what you think some of the challenges are to implementing these.
APS has been teaching health education for probably 40 years, and as a graduation requirement taught by licensed health educators. And that was the biggest, I think, challenge in this state, was to get health education as a graduation requirement. So now that happened, and part of that, in order to do that, it has to be taught by a licensed health educator. I think the biggest challenge is it's typically across the state, and in APS, it's a semester course. APS has gone the extra mile, where we actually also require it in middle school, and we have requirements in elementary school.
That's an APS decision to do,
That's
though.
an APS decision. That's not across the state. The standards are K-12. The challenge, I think, is to get people with the knowledge and ability to be teaching these topic areas. We wouldn't ask, you know, a science teacher to go in and teach reading. That's not what they're qualified to teach in. But yet in this state, for a very long time, we asked the science teacher to teach health education. We've asked the PE teacher to teach parts of health. It was integrated. And what we found is that it didn't work because people weren't comfortable. They weren't taught in their teaching when they became teachers how to do that. If you look at the health education standards, there are 7 of them. There's only 1 that's focused on knowledge. The other 6 standards are skill-based. They're skill-based standards. They're focused on communication skills, relationship building, peer education, role play. As a science teacher, that may not be where I go.
I wanted to ask Anita, so we heard from Liza that Santa Fe has taken a fairly comprehensive approach to this.
People from Planned Parenthood, Solace, and Impact teaching content areas that pertain to those particular things. And then the nurses actually teach the anatomy and physiology portion of it with the teacher present. The middle school sex education or health education course is very comprehensive, and we get a lot of positive feedback from students and staff. The high school curriculum, the one that they get a credit for in high school, is only a semester, and again, it's a huge amount of information to be taught. And in Santa Fe, what we would like to do is move towards a full year of health education, but do it in the 8th grade, because we think that the summer between 8th and 9th grade is a very crucial time for children with risky behaviors. And there are a lot of kids at that time that are given more freedom because they're at that teen age and they have more time on their hands, and they don't necessarily have the education that they need to make smart decisions. I think that having access to contraceptive counseling, as well as the contraception itself and the confidential services on the school campuses, really makes a huge difference in the students taking responsibility. But I would like to see them utilize those centers more for other things as well, to help them to grow into their maturity and start to find a healthcare provider for other things.
These larger contexts that Caitlin, you brought up about becoming just more knowledgeable about your own health, about accessing health services. I mean, does that go towards what you all were recommending in terms of coordinating more effectively around teen pregnancy? Is
correct.
Okay.
Across all of those different areas, but also taking into account where the state can target its resources to have the biggest bang for the buck. In the near term, if we can't have every single community come on board immediately, you have to start targeting where your biggest challenges are. And so Bernalillo County doesn't have very high rates, but the sheer number of teen births is the largest in the state by far. So if you can ensure that you're delivering comprehensive and coordinated community-based services, including the schools, and reduce that by 1/3 to half, it will have a big impact on your overall statewide teen pregnancy rate. The same thing with targeting those counties with very high rates, including Lee County, Luna County, and many other counties over on the east side of the state. You can do the same thing.
But we have a severe lack of providers. I mean, yes, you can reduce rates by some education, but my understanding is the real rate reductions come with easy access to reproductive health and birth control.
One of the things I want to bring up is long-acting reversible contraceptives. That has been the first, recommended as the first line contraceptive choice for adolescents by American Academy of Pediatrics and ACOG as well. And so I think that's one of those clinical implementations that Department of Health could potentially support to make that more accessible and also more affordable for on the patient level and also on the clinic level. So
we're talking about IUDs and subdermal implants,
right?
And those that have been used in Colorado to great effect.
I had a question about that because the LFC report said that as well. But what about STD rates? Do they go up?
No.
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 Yeah, the evidence doesn't show that. And part of, best practice, which is something that I work with, school-based health centers to implement, is that guidance should be still provided to adolescents that they should still use a condom with every act of sexual intercourse. So that doesn't change, and that's across the board no matter what contraceptive option they're choosing.
Is this an appropriate role for government to take, or should we be empowering and educating parents more?
Well, it costs New Mexico $100 million a year to take care of these babies and provide health care.
Yeah.
I feel like I do have a different perspective to offer here. So at Young Women United, we do not believe in teen pregnancy prevention. We believe in making sure that people of all ages have the information, resources they need to make real decisions about their bodies and lives. So, things have been falsely attributed to the age of teen parents. So there was a seminal study in the Journal of Economic Perspectives just in 2012 that proved that the age of parent does not impact all the factors that have been listed. So there are children more likely to be incarcerated, lower economic futures, any of those sorts of things. What actually impacts that is their current economic trajectory. So if you're likely to have been born in poverty, you're more likely to raise a family that's born into poverty. The age you become a parent does not impact that. As someone that's worked with young people, I think it's our state's responsibility to make sure all young people finish their high school education. I don't think it's right to blame teen parents for saying, you dropped out of high school and this is what's happening in our schools, that we can look at what are the resources that are really impacting young people over a lifetime.
When a girl is 16, and she's making a choice maybe to have a child, does she really understand the impact of that decision?
Well, Megan, we're looking at the LFC report that 70% of the teen parents in New Mexico are 18 and 19. I think if we're really making a decision that we can send a young person to war, but we're saying they're too naive to raise a child, that's a different decision. I absolutely believe in sex education and do not want to put out anything different, but we can change sex education models from saying that if you become a teen parent, your life is over, you have all these negative statistics, to really saying that people of all ages need to be able to have access to contraception, to family planning, to conversations about healthy relationships, to be able to decide when they become a parent.
And if you look at the health education standards, that's what they are. A lot of the lessons that our health educators do are around consequences. We have one project that a lot of our health educators do that's a very comprehensive project that's it's done in the sexuality unit, but you're given all these different scenarios. You're now pregnant, or you're now a teen mom, and the boys, same thing, you got a girl pregnant, or that kind of thing. And some of the scenarios, mom and dad are going to support you, other scenarios are not. They have to go out and find an apartment, they have to go out and find a job, they have to go out, and they actually have to make those phone calls. They have to actually do that and find out how much it costs for an apartment, and what is it going to take, and if your decision is to drop out of school, how's that going to impact?
I think even the word dropout implies that it's that individual's problem. It's a societal problem. We're not supporting youth and families to finish high school.
Blaming them is just going to make them feel bad about themselves. I mean, yeah, it's going to be, you made a bad choice. Yeah, you did. But here's some options. Here's how we can help you. Here's some different people you can talk to. And I think that a lot of people don't realize that they have feelings. So when you say, oh, she dropped out of high school, she got pregnant when she was 16, her life is over. Yeah. I think that you're just hurting them more than you're helping them.
And you want that baby to be in a safe place, but you also want to help the parents understand parenting. Because it's hard, it's tough no matter what age you are. Yes. And then there's that support system to get through school. And yes, 18 to 19 is a lot better than 15 to 17, but the national campaign is I went to the Texas campaign annual conference, and they had a whole session on called the fog zone, that 18 to 19-year-olds, you're still very vulnerable. It's a tough road to go. It's a tough path. And if we want to advocate for kids, we want them to take an easier path than a lot of us have had.
I think to do that, you have to build vision. You know, if you have a young person participate in community service, you're improving their vision. Like, look what I can do to make my community a better place. Look what I can do to become more important to people, to my family. Look what I can do. And I think that's where we fail in a lot of these programs, and where the Wyman Teen Outreach Program really hits it home with the 20 hours of community service learning.
Which you had to do, right?
Right.
Mm-hmm. What is I wanted to ask our students, Knox and Kira, what you guys think of that.
You were doing a program like what my mom runs, and you like went like to help like an animal shelter or something, then that just grows on you as a person. Like, I can do something better with my life than just sit at my house and do nothing, or go and have sex, or do something, do drugs, or drink alcohol, but actually like do something that's important in helping other things.
Yeah.
Did your service, did you feel that way about your community service?
Yeah, we had to clean trails. I mean, it was bad. There was like alcohol everywhere. There was tree limbs that weren't cut. You had to duck and get over them. So we cut them. We cleaned it all up so that it was safe for people to not only walk, but they could like go there and exercise and run and stuff. So
how'd that make you feel?
It was okay. Yeah. I was kind of annoyed, but it made me feel very appreciative of my community.
Yeah.
It made me feel like, wow, it's pretty. It's not just weeds.
Yeah, it makes you feel accomplished, like you did something.
And I think on the topic of supporting people that, like girls that get pregnant in high school, like what you were saying, helping them like have a goal, have a vision. So they don't just have this idea that their life is going to be taking care of a child, that, you know, they can get out of that circumstance and really grow and become someone important in society, and, you know, help themselves, help their family, help their overall community. I think would be hugely important and is sorely missing.
You asked a little bit earlier about what can the state do. Well, one of the things is they can increase funding for the grads programs. They're not everywhere, and the reason that they're not everywhere is because there's not enough funding for them to be everywhere. You know, I don't know too many school districts across the state that wouldn't jump on it if there was enough funding for them. In APS, we have New Futures, which is an actual school that we support. When they graduate out of there, not only do they get a diploma, they also get a home health care. They now have a provider. They have someone that they can continue to go to, and they learn about the health of not only themselves but of their babies and how to raise them in a healthy way.
It's important that we teach young people that life doesn't just happen to them, but give them the skills to make their life happen in the way that they want.
Is that what you do, Liza, with your curriculum?
Yeah, we have several different types of curriculum at Planned Parenthood. In Santa Fe in particular, we go in with Solace and we go in with Impact, but we also run a girls group there, similar to the program it sounds like that you're running in Hobbs, but a little bit different. That's all about civic engagement, social justice, they are tasked with creating a social service project or a community service project as a group, so they develop a project together. So it is not just how to put a condom on, right? I can teach. Very important to know how to put a condom on correctly. It's extremely important. When people don't know how to do it correctly, they're doing it incorrectly and they're less effective. That's part of it, but it's also part of talking to other people, having respect for your community members, learning how to listen, how to say no, how to talk and negotiate your boundaries, but also how to hear boundaries and how to respect others.
So what, as we near the end of our show, what are the next steps we should be looking at? I think you were going to say something. So.
The state funds a myriad of different services and strategies. GRADS is a good one that really need, again, to be better coordinated and prioritized and be family-centered. Nationally, you call them two-generation models, that essentially you're trying to make sure that the mother is successful economically through completing high school education, post-secondary, but we're also funding services for home visiting nurses to go in to help with intensive parent education, make sure that the kids get off to a good start. And then we've made big investments in child care assistance and pre-K, so parents can go on to their post-secondary education work. But all of that is in a very fragmented approach, and it's not family-centered in a way that's helpful to those very young mothers in the way that it needs to be. And so that's an area for continued focus.
There needs to be more funding for school-based clinics and for the Department of Health to be on the preventative side too.
Certainly, and school-based health clinics, we found need to be an integral part of the overall equation, and they also need to better leverage Medicaid financing to make sure that we can stretch our state dollars further in an appropriate way.
Because under the Affordable Care Act, Medicaid is supposed to cover all contraception, as I understand, correct?
Correct, and if providers don't know about how to bill it, or if providers aren't signing up to be able to bill Medicaid, or if school-based health centers aren't in a position to bill Medicaid, then you're missing out on making our dollars go further for other investments in programs like grads.
So where should this leadership come from to take us to this next step where we have more comprehensive sex education?
I think it's important to highlight what we're doing well and what's working. Here in Albuquerque, we have a very successful peer education program at South Valley Academy that Planned Parenthood has been facilitating for over a decade now. The South Valley Peers in Action, this peer ed group, goes and teaches sex education to their peers in their school at South Valley Academy, but also at middle schools and other high schools, and even to adults.
What about the roles of parents in terms of lobbying the legislature or their schools, but also, I know we have two parents here, but you guys are a little unusual in terms of their own actions with their kids.
I can speak to that a little bit in terms of the parents that we have at Mount Mahogany. I think that they were very active, and they actually called Planned Parenthood to get the information of what was going to be taught. We worked with them in building the curriculum and the model and how we rolled it out. And they also looked at the other options around the community. So I think
do they also look for information? I mean, they want to be able to, I mean, I'm sure not all parents feel comfortable talking with their kids.
I think it would be, a goal would be to have a two-prong approach, to be having these conversations with our students in the classrooms, but also be offering forums for adults to have these conversations.
Well, and that's what My Power does. I mean, we meet with 1,000 parents a year, and everything is bilingual that we give out. The national campaign has excellent materials. Talking to your kids, here's the facts, here's what your children need to know, what you need to know. A lot of parents don't know.
Right, and when I was on the School Health Advisory Council on the reproductive health group, there were a lot of parents saying, we don't know how to talk to our children. So having that, information is really helpful.
It's absolutely critical, to go back to Phoebe's point, of access to resources and healthcare, because as you mentioned, Megan, STI rates continue to climb for young people, particularly for young people of color. We haven't seen a change in New Mexico around any of these statistics. And when we work with young parents across the state, and the majority of those young parents, I would say 95%, had an unintended pregnancy. Rates do not actually differ from young people to women of older ages of unintended pregnancy. It's just how we stigmatize it. So, I love the idea that young people need to be able to have space to vision, but I also believe that young people don't envision themselves dropping out of high school or not being able to provide for their family. So what it would really take is getting resources in the hands of those young people so they can actually make decisions about their family, so they have access to the providers and to the care they need.
Well, we could talk forever about this. And I appreciate you all coming and talking about it. We have to end, unfortunately, but please stay around and continue discussing. Thanks for coming.
Thank you.
Thank you.